Hi, Mommy. I bet you're asking, how do I nurse my baby without pain? There's a few reasons why breastfeeding might be painful, but there's one that's really common that I see most often, and I want to tell you how to avoid it. Let's go. Hi, Mommy. My name is Mary Cahill, and I'm a certified lactation counselor. I use correct and easy to understand information to help mommies like you to be confident and successful in their breastfeeding journey. The most common reason for breastfeeding pain is improper latch and position. I can't tell you how many times I've gone in to help a mom who's been in excruciating pain, and with just the slightest tweak, it was a totally different experience. If you're having excruciating pain, there's something wrong. Yes, it should be just a little uncomfortable, but it should not be toe curling pain. You need to ask for help right away if you feel like there's that kind of pain. If you let it keep going, it's only going to get worse and cause damage to your breast. If you are having pain, it's not your fault. You need to ask for some help. Latch and position is important for several reasons: pain, transfer of milk, and establishing your milk supply. There's a few different positions that you can hold baby in while breastfeeding, but I'm going to tell you about the main ones and what I like best for when baby is newborn and real small. Cradle hold is when you have baby's head cradled in the crook of your arm. You want to be sure not to have baby's head down in your arm. You want to have it resting on top of your arm so baby's head is free to move. And then you'll have this hand to support and help baby. And then there's the cross cradle hold. And that's where your arm is supporting baby's body and baby's rear end is more in the crook of this arm. And you're holding baby's head behind their neck and a couple of fingers to support that head. And you have the hand free on the breast side that baby's latched to support the breast. I like this position best for new moms to start out with. It helps to be able to hold your breast and help baby to get latched. The football hold is really helpful for moms that have had a cesarean section. If you're having pain in your abdomen, it kind of hurts to have baby laying across there. Plus, in the football hold, you can see baby's face, and it's a little easier to get baby latched when you can kind of see what's going on with their mouth. There's the side lying position, where you're laying down in bed with baby. There's the lying back position, and that's usually how you nurse baby in the first couple of hours, but it can be very comfortable to nurse baby that way later on too. Whatever position you're holding baby, baby should always be tummy to tummy to you. Never turn so I can see one arm up or baby's tummy. Should always be totally on their side, one arm down, one arm up, so that they're hugging your breast. So say it with me, tummy to tummy, so you remember baby needs to be in tummy to tummy. If baby is turned upright, then they have to turn their head to latch. If you're eating, say, a big hamburger and you have to turn your head, you're not going to get your mouth open quite as wide, and it's going to be hard to swallow. But if you're straight on when you eat, it's going to be easier to get your mouth open and easier to swallow. So that's why we want baby straight in alignment. We want their hip and their shoulder straight in a line. Baby should not be turned and turning at all. You should always start a feeding with baby's nose at your nipple, nose to nip. So when baby's head leans back to open wide for the nipple, then their chin should be pressed into your breast and nose not touching at all. The reason for this is if your nipple goes straight into baby's mouth, it's going to rub on their tongue. When you start nose to nip and baby leans back to grab the breast, and they get a wider mouth open, and the nipple goes into the roof of the back of the baby's mouth, not in against the tongue and rubbing on the tongue and causing you pain, and not in so it's shallow and pushing down on the roof of their mouth. So if you start with the nipple at their mouth, it goes in and it's rubbing and causing pain and not in as deep. But when you start at the nose and they go back, it gets more breast tissue in their mouth and less pain for you. When baby's latched, baby should have their lips flanged out, not curled in. If baby's latched and you can see that their lips are in, you can usually put a finger in and kind of help a lip to flange out. When baby's latched, it should be an asymmetrical latch. That means the nipple not in the center of their mouth, it should be more towards the roof of their mouth so that that nipple has more room to be able to be at the top roof of their mouth so it doesn't cause you pain. You should be able to see a little more of the top of the areola, but the bottom of the areola should pretty much all be in baby's mouth. If you're feeling pain while baby's latched and it lasts more than the first 30 seconds, then you want to take baby off and relatch again. You don't ever want to just pull baby off. So if you push in next to baby's mouth on your breast, it'll break the suction so that baby can come off easily. Each time you go to latch baby, it might take quite a few times before you get a good comfortable latch. Be patient with you, be patient with baby. This is new for both of you. At first, you're going to feel like you need another hand, especially when baby wants to put their hands into their mouth. And babies have been chewing on their hands for 9 months. They want to still suck on their fingers. If baby's hand gets in the way in here, then it's going to make baby not able to get in tight to you. So hands need to be out of the way and baby's chest and tummy in tight to you to be able to get a good latch. You want to support your breast to help baby to latch. And if you're really large breasted, you might roll up a little thin little washcloth and put it underneath your breast to help to support your breast for baby. If baby is having trouble latching, you may need to sandwich your breast. And a sandwich, like you're eating a sandwich, is this way. You don't want to sandwich this way or it'd be hard for baby to latch onto that. So you don't want to sandwich like this. You want to turn your hand under like this so that the sandwich is going the same direction as baby's mouth. When you sandwich your breast, you want to be sure that your fingers are on the outside of the areola. If they're in on the areola, they're going to get in the way of baby's latch. Also, when you're sandwiching your breast, you want to push in towards your chest wall. So not just a sandwich, but you're going to sandwich in towards your chest wall and a sandwich. That will help your nipple to pop out and be easier for baby to latch onto. Watch for baby to open their mouth wide. When you see that, you want to bring baby in pretty tight and aggressively into the breast. You don't want to push baby's head forward and smush their face in, or that'll make their mouth not be wide open enough and help you to not have a painful latch. So you want to bring baby in pretty firmly, but their chin pressed into your breast and nose not touching. When you get ready to feed baby, be sure that you're sitting in a comfortable position. I like to tell my moms to sit like you would if you were watching TV, totally relaxed. Be sure your shoulders are relaxed and you're comfortable. It's going to be easier to latch baby if you're relaxed. Breathe, relax. When you bring baby into the breast, be sure that you always bring baby into you and that you don't lean over to nurse baby, or that's going to start to hurt your back. And when you go to latch baby, bring baby to your nipple. Don't move your breast to baby. Okay, bring baby in. Mommy, I want you to be able to nurse your baby without pain. If you start to have a problem, ask for help right away. Find your local lactation counselor and ask beforehand, if I have a problem, will you come and visit me in the hospital? Or how do I call to make an appointment? Do you do virtual appointments? Be sure to set up a plan before you have a problem. Let me know in the comments below, Mommy. Is this your first baby and when's baby due? If you already have baby, how are things going? I hope this video has been super helpful for you, Mommy. I'd really appreciate it if you'd like and subscribe to my channel and share this video with any other moms that you think might need this information. And as always, Mommy, you got this.